time to introduce our second speaker. Our second speaker is Ms. Amna Iftikhar. Ms. Amna Iftikhar is clinical psychologist at Rambo Obesity and Eating Disorders Center, Evercare Hospital, and she is PhD candidate in clinical psychology. She will guide us through the psychological and behavioral dimension of fasting and mindful eating and a sustainable eating habit. She is going to explain metabolic reset, fasting, emotional regulation, and cancer protection. Over to you, Ms. Amna. Over to you, Ms. Amina Iftikhar.
Thank you so much. Basically, this is like sometimes when we are talking about the metabolic issues, fasting, and somehow the chronic diseases. So many times we undermine the psychological impacts. So thank you so much for inviting me to talk about this important and fruitful topic when specifically we are talking about the prevention because many times when we are talking about the cancer prevention, so we most of the time focus on the genetic aspects, the environmental aspects, and very much focus on the diet and lifestyle. But unfortunately, there are so many other things which we need to highlight, we need to educate, and even being the practitioners, we have to have a knowledge about this. Sometimes the chronic stress, emotional dysregulation, and the impulsive eating patterns and cognitive distortions leads towards such unhealthy behavioral habits which can increase the chances of having such chronic disease like cancer. So when we are talking about the prevention, so prevention begins in the brain. So whenever you are focused on your psychological well-being, your cognitive patterns, it is a helpful tool for you to understand the biological and the psychological aspect for such diseases. So whenever a patient come to us and they are like having multiple issues, sometimes they just ignore the psychological factors and they are very much like concerning about other health consequences, like if somebody have some diet related concerns, so they are very much open. If somebody has some physical concerns, so they are very much open. But many time people are struggling with chronic stress and they just ignore, because culturally this is a norm. We are most of the time just cope with stress by diverting ourselves, or many times just suppress. So chronic emotional stress usually leads to increase the cortisol levels. And now this is something which is linking from psychological to biological pattern, and how it is important to like slow down the process of those chemicals, so this can help us to prevent the cancer in future. So when your cortisol level increase, definitely it can cause inflammation, it can like suppress your immune system. And whenever a person have poor immune system, so it might be like increasing the chances of having chronic diseases. So with the suppressed immune system, it can lead to increasing the insulin resistance. So it means that all of the basic hormones a human body need to have the healthy functions. So because of just the chronic stress, this hormonal system got disturbed. So all of these factors are linked to increase the cancer risk. So this is prevention is very important, because management is one thing and prevention is important, because it can reduce the cost of medical services. It can even if it diagnose and identify at the early stages, so it leads toward the good prognosis as well. So always keep in your mind whenever we are talking about prevention. So first of all, we need to know about the factors as well. So psychological factors are important in developing the cancer. So after chronic stress, biological aspects, our emotions are very important to highlight. sometimes, people are even not well aware about their emotions. Sometimes we just cope our negative emotion with some negative behaviors as well. Sometimes they end up on emotional eating. Sometimes they end up on really unhealthy sleep patterns. Sometimes it is leads toward, if you just ignore the stress management, so it can like increase the chances of unhealthy coping mechanism. So why it is important for we need to know about the emotional regulation and to focus on the eating patterns, and if we just ignore it, it can increase the risk of having the cancer, because emotional dysregulation usually linked with the impulsive eating. And impulsive eating, people habitual to have the binge eating, and in binge eating they prefer to have the comfort food, like some people crave for the sweet stuff, some people crave for the frying stuff, some people like prefer the salty, the crunchy stuff. And whenever a normal person increase the food intake, and basically the junk food intake, so if they compromise their physical health and increase the risk of obesity. And obesity is linked with insulin resistance, chronic inflammation, which can increase the risk of cancer. So here the point to highlight is psychological patterns become the biological risk. So simply, when we are talking about the stress, as I mentioned, our coping is just like we park it, we just divert, and sometimes we go for the unhealthy eating pattern or some other unhealthy coping mechanism. But this is the fact, if you are ignoring the psychological patterns, so this can be a risk to like abruptly change your biological functioning. So, fasting as a cognitive exercise, because in fasting there are multiple concepts. Basically, being Muslim, it started from the religious perspective, but scientifically proven. This is a scientifically proven fact. Fasting is helpful to regulate the diabetes, insulin resistance, manage weight, and some other like health benefits are also linked with fasting. So if we take a look from psychological cognitive aspects, so fasting is a very helpful and a positive cognitive exercise, because whenever you are focused on your emotions and on your cognition, so this is something which gave you more self control. So self control actually leads to toward helping and reducing the overeating cycle, because whenever your mind, your cognition are logical and intact, so it is somehow linked with some controlled and some positive emotions. But if you overthink, if you stressed a lot cognitively, so definitely it will increase the negative emotions as well. So to handle the negative emotions, this is somehow linked with the binge eating and unhealthy eating patterns. And when you control the overeating, so usually people shift toward the more healthier food option, more healthier lifestyle, which help an individual to have a stable weight, to regulate your normal BMI, and to gain some health benefits as well. Whenever your stress levels are low, it helps to reduce the insulin spike as well. And when your hormones and your metabolism is on a regular path, so it can lower the inflammatory burden on from your body as well. So this is very important to notice that self control is a protective health factor. It is not only related with cancer, it is also related associated with other chronic health diseases as well, because your mind, your brain is actually the major factor. If you feel good, if you think good, if you are having a more good emotional regulation pattern, so your body hormones, your neurotransmitters, they are working in a very effective and regular way. So that's why I always mention, if you want to improve your quality of life, so basically the first thing you need to think about is your emotional well-being, your cognitive wellness. So fasting and distress tolerance have a very helpful connection. So when you do safely the fasting, so it means that it increase your distress tolerance as well, because religiously the fast is about to develop the patience, the sabr. So whenever you develop a control, whenever you develop a patience level, so this is something which increase the emotional tolerance, which in strengths the comfort endurance, which help you to reduce the impulsive reactivity. And whenever you regain a control over your emotional distress, over your like feeling of being discomfort or feeling overwhelmed, and somehow it will help you to reduce the impulsivity. So this actually improves long term stress resilience, and resilience lowers chronic inflammation. So stress and inflammation link is very important, because whenever you are under stress, so definitely unregulated emotions are linked with cortisol spikes and pro-inflammatory cytokines. Cellular damage risk will be increased. So this is important when we are working on the regulation and the prevention. So you need to regulate the emotions, your cognition, which can help you to reduce the inflammatory load, improve immune surveillance, and psychological stability to protect your body cells. Then fasting, even sometimes if we just ignore the red flags, and fasting is not helpful for all individuals, so it might can be harmful in a way. So if I talk about the risk group, so people struggling with emotional eating or eating disorders, are having the severe anxiety or PTSD, traumatic history, are rigid perfectionism, are having some personality disorders. So even in some cases fasting can worsen the condition, because people with those issues can restrict their food intake, or sometimes they overeat or binge more. And with anxiety, people have like always a fight or flight mode, which can lead toward some physical psychosomatic symptoms, and this can increase the risk of repeating this cycle and develop more fears in those individuals. So fasting may trigger restrict binge cycle, because it leads toward the self pity, and sometimes because you are fasting and people think that so all the day are in the fasting window we are not eating, and when they just break the fast, so they binge more, they eat more, they crave more. So this can be harmful, and this can be challenging in many situations. Somehow the other risk factors are the other red flags can be obsessive thinking. So many times patients come to us and they are reporting whenever they are fasting, so they always have the food thoughts, they always think about like what they have to eat, if they are continuously checking the healthy outcome and their weights as well. So this obsessional thinking become a repetitive pattern,